Good evening and welcome to the OR with Dr. Kidel McFarland. Today we have a 21-year-old female patient who shows symptoms of adult ADHD, new onset or change in pattern of headaches that gradually become more frequent and more severe, unexplained nausea or vomiting, gradual loss of sensation or movement in the arm or leg, speech difficulties, confusion in everyday matters, and personality or behavior changes. The MRI and biopsy revealed that the patient is diagnosed with pineoblastoma. Pineoblastoma is a type of cancer that can form tumors in the midbrain section. The tumor develops in the pineal region of the brain. Our goal is to safely remove the tumor. We're going to use her tumor as a vaccine for future patients. There has been a breakthrough in discoveries to show that cancers can be used to fight cancers. We shall undergo the procedure.
So,
welcome to behind the scenes.
Exactly. So you stuff it in the hole.
All right.
You got it?
Yeah, I'm stuffing my mom's head with tumors right now. I'm pretty sure this is illegal, but who really cares? I mean, it's Hollywood. Yeah. Drop the bass. What? Yeah. All right. Okay, let's go. Do I have to hit you in the head with the lamp to get what I want?
What do you want? Shut up. Okay, sorry. But you already knew I wasn't going to be a very good compliant patient. That's why you put these little restraints on me.
Yes, because my nurse said that you were diagnosed with not only ADHD, but often sudden changes in behavior, so...
Oh, so you think I'm a danger to you?
I've also witnessed it firsthand. You know, I'm just saying, look at this little mini scalpel. Like, the way they shape medical tools is absolutely genius. I mean, like, even just look at
your mother butt is sitting on the island of her table while you admire your tubes here.
That's just... Oh, I'm sorry. Is there a problem?
Yes. It's called the left and the right one.
Action. Cut. You can't move your arms right before the screen starts. Okay. First, I have to get the incision. Now, some of your hair may come off, and you may end up bald, and you may even feel this on your skin. But just remember, you signed up for this. And I'm not paying you extra. And I'm not paying you at all. Okay. Just gotta, hold on, let me see. I'm just gonna make a small incision with the scalpel. Then I'm going to follow up with the scissors because I found that the scalpel does tear the foam and it makes it nearly impossible to sew it back together.
You can't cut real
skin, yes. But do they need to know that? No, they do not.
But they would know as soon as they see you cut it.
As soon as they see the behind the scenes part.
Oh, okay, but it's the behind the scenes. Oh, I didn't know that.
I mean, we got a talking dead body here, so I'm pretty sure.
I'm already dead. Why are you having surgery on me, dude? Huh?
Vaccine. I explained it.
What a way to instill confidence in me on your surgical ability.
I mean, I already told you, like, we're using you for a vaccine, but never said we were going to save your life.
No, you said you were going to take my cancer out, turn it into a vaccine, and inject it back into me so that my own cells can fight my cancer cells.
You see, that was in the script. That was in the script. But do you remember what I said? I said there's been a breakthrough in science where we can use cancer to fight cancer. So therefore, we were going to use your tumor as a vaccine.
So I'm a victim. I had to take one for the team. I gotta lose my life.
Leonardo da Vinci was a grave robber. Okay.
Excuse me.
You should be thankful that I'm not showing up 5 hours after your funeral just to steal tumors from your brain.
I would like for you to steal a tumor to help me. I know we should be thankful and give it to the world and the heart and kumbaya and let me save. I'm gonna need you to save me first. I'm gonna need you to be down for me, and then we can worry about everybody else later. Okay. Let me know when you're ready.
All right, I'm ready. Action. Okay. So, right now, this is after the incisions, and I'm going to remove the tumor from my victim, my patient here. Now, very steady when entering the brain, for if I trigger just the wrong response, all else will fail. And I feel like I am passing the occipital lobe. Here we go. And there, my friend, is your tumor. Now, I personally hate tumors. They are like the most useless problem out there. I mean, most diseases, most malfunctions in the human body, most mutations have some useful side effect. Maybe delusional. Now, I say this because when you're delusional, you get to escape reality, or maybe superhuman abilities. But tumors, absolutely worthless. Now, let's see if we can just clean this up a bit. This is a sterilizer. It removes all germs and mucus that recently entered the brain from my hands and from the air. Many germs and diseases are airborne. And now I shall close the incision, which tends to be the hardest part. Cut. Yeah, I forgot to put the needle through the thread through the needle. So yeah, here comes another behind the scenes
of lameness. You're the most
of lameness.
Surgeon. I'm just like Sam, boy.
I mean, last time I checked, I was the doctor, and you're the person that's about to die. I mean,
how you about to die?
You're the person that might die at my hands. So if I were you, I would have some pretty nice things to say. Not to mention that me.
Boy, your bedside manners suck. That's your bedside manners, really, son.
And my posse of nurses have control over.
Okay, family, y'all got this for the record. We need to do a lawsuit against.
See, I could put you.
Medical doctor Keto Quentin McFarland.
All I have to say.
You know you can go to jail for abusing your patient, right? You know you can go to jail for malpractice for killing your patient.
I'm sorry. Did you sign up for this? Yes. Did I go to medical school yet? No. Am I even in college? No. So, what is the problem here?
The fact that that's malpractice. You're practicing outside of the scope of what you authorized to do.
Is that a problem, or is that something that you prefer I didn't do?
That is both.
Sure. I think you should be really nice to the person who's sticking needles in your head. Now. What are you looking at? Oh my gosh! Do you see? I hope I got like a great action shot on that, because she picked up the pointiest probe known to mankind and just about stabbed me with it.
Ouch, that does hurt.
Yes. And you barely even touched yourself with it.
That's kind of sharp for real.
Yes. Mother, this is not a child's Build-A-Bear workshop toys with fake hammers and giant unrealistic sized bolts. No, this is a synthetic surgery. Ah!
You done peed on yourself.
Alright, you missed miserably because, that you
done peed on yourself.
See, this is why doctors should get paid 3 times as much as
but you didn't go to school. You just said you didn't go to school.
Am I a doctor? Do I have needles in your head? Do I have probes and scissors?
What moment you not?
I never said I wasn't a doctor, but I never said I went to medical school.
You gotta go to medical school, son.
Says who? Doesn't take credit for her deeds.
I don't. Because I only take credit for the things that I'm responsible for.
This is why she's on a very cheap deathbed. She's not even paying me to do this. She's in a very cheap doctor's office for that.
Well, I will get you when I get up.
When you get up. So then I guess I just won't finish the surgery then. I'll just leave you you right there.
I mean, you got my scalp all open and I'm talking. I guess this is a live surgeon or something. This has got to be the most bootleg ghetto.
Precisely
This
what
is the most ghetto bootleg thing you can think of.
I mean, what did you expect? You're not even paying me. I don't even have a nurse.
That's because you're too cheap to pay for a nurse. That's not my responsibility.
Is that well, you know, that's because I get people like you coming through here that don't pay me anything.
If I'm on food stamp, welfare, government cheese, how you expect me to pay for a surgery like this?
Because then you don't have to pay for anything else.
Madness, son, madness. We're ready.
All right,
take this out of the
If
scene.
you're on a deathbed,
Here, okay.
and you look up, what is the number one thing you do not want to see the doctor holding?
The number one thing I don't want to see the doctor holding is his cell phone.
All right. Now, Miss McFarland, if you look up when you're on your deathbed,
Here, take this.
what is the number one thing you don't want to see a doctor holding?
A scalpel.
A scalpel. 6. All right. Miss Naomi Sanders.
Mm-hmm.
If you woke up on your deathbed, what is the number one thing you don't want to see the doctor holding?
Beep. Part of my brain. The organ.
Part of your brain. 21. All right, let's go. You have 1X. Now, I'm going to play a special round here, not played on any other episode. If you can guess what's on my mind, I'll give you all the points. But if you can't, you are eliminated. Now, if you wake up on your deathbed, what is the number one thing you don't want to see the doctor holding?
A gun.
A gun. That must be the most ghetto hospital in all time.
Hey, we in the hood. The doctor got to carry a piece of steel, you know? The keys of peace in the OR.
Not a piece of steel. Piece be still.
Well, I'm sorry. He need a piece of steel to keep peace in the OR.
A gun.
Yes.
Survey says. What was the number one answer? A nurse.
You don't want to see her holding a nurse? You're absolutely right on that one. I want my doctor to be focused on me and not his nurse. Oh, that was a good one.
Thank you.
That was a good one. That one definitely goes on the behind the scenes moment right there. Okay, Doc, how long ago take you to come stitch me up? Boy, I'm going to bleed to death and everything else.
Is that a problem?
Yes.
I get my vaccine. That's what matters. No, actually, I gotta kind of like review the process. Oh, wait. Boom.
But this is sad. You're experimenting on me, boy. You know you're going to have to take care of me. You know you can't put me in a nursing home. Put me in a nursing home and throw poop on the wall every single day till they kick me out.
Hey, just be glad that I didn't have to read Being a Doctor for Dummies before I got here. Oh, look what you did, mother.
Okay, sorry. Oh, look, you had me laying here for like 30 minutes, 20 minutes. I don't know. You asking me to be still? I'm trying. I'm trying here.
Hey, I warned you ahead of time, didn't I? I said you're probably going to be there for about an hour and a half. What do you say? No, it's okay. No, you're not going to be there for like an hour.
I was going to take one for the team. And you wasn't going to take one.
Yeah, you're taking like 3 for the team, so...
I'm going to need Jenny to return back to Virginia so she can just be your little guinea pig then.
Oh, by the way, this video was made in special regards to Jenny Sanchez. Thank you, Jenny, for the wonderful gift you have brought me.
Yes, I can get my weave done now.
No. The thing is like all lopsided. I don't even know what you did. I mean,
okay, I'm sorry. I moved.
See, this is what happened when you have mentally insane, delirious patients. This is why I make sure all my patients are dead before I operate on them.
Dead?
For this reason right here.
Why can't they just be asleep?
Because I can't afford medications like that. I don't even get paid. I just explained this to you.